When we're looking at treating scoliosis, we know that surgical intervention is a relatively recent phenomenon in the history of treating scoliosis. And in fact, putting rods in the spine and putting screws to stabilize or try to stop scoliosis progression has really only been around since the 1900s. And in fact, they've only done these techniques that they're doing today are relatively new, using pedicle screws and multiple rods to try to stop curves from worsening. And one of the reasons why they started advancing these techniques is because of the amount of scoliosis surgery failures that were happening when they're just using pedicle hooks and that were hooking to the side of the vertebra. Now, the problem is that the long-term results, the long-term effects that these rods can have in somebody's spine is really unknown. What I mean by long-term is 30, 40, 50 years from now. We don't know what these long-term effects could be, and we don't know how they're going to impact the person's health and well-being and how it's going to affect their function. So many patients are seeking alternatives to surgery, even though that the alternatives to surgery existed before surgery existed, and that is typically bracing, therapy, rehabilitation, and exercise. Now, the good news is those things have also evolved over the years, and the consensus now is that a lot of patients are now getting very good results, corrective results, with these non-surgical approaches, much better than they were getting before with the conservative approach that before surgery was actually something that they were doing. Now, the problem is that many patients are not aware, and many surgeons are not aware, and because surgery now has become more of a mainstream, most scoliosis patients are managed by orthopedic surgeons